I'll call the Planning Commission meeting, the Brattleboro Planning Commission meeting for Monday, March 4th to order. We do not have a quorum this evening, so the only business that we will conduct is the element on the agenda known as item D. We'll have a discussion about the Project Care program. And with us we have Josh Davis from Groundworks Collaborative and Adam Petlock from the Brattleboro Police Department. Yeah. Thank you both for coming.
Thanks for having me.
So I thought if I can just jump in and set the stage a little bit, because I don't remember if I talked with you about this or Rihanna shared it with you, but the Planning Commission is about to start on a downtown master plan, a design plan. And so we will be doing public outreach. We know there's concerns by some in the community about drug use, panhandling, homelessness, not all intertwined, but sometimes related. So, we were just interested in hearing about what efforts are going on in the community and kind of just so that we can be prepared to direct people to resources or have a response.
Yeah, and we understand that the Project Care program is a big part of that, so we want to be informed.
Fair enough.
And I think another piece of it is also like our downtown is for everyone. And so if there are any tools or recommendations that you could make on how to engage populations that don't usually show up at our community engagement meetings, I think that would also be very valuable.
Thank you for that.
Could you say just a couple words about, you said substance use, folks downtown asking for money, people that don't have housing, their concerns for some in the community. How does that fit into the plan?
To the plan.
Yeah.
So one of the elements that we're looking at in the plan is kind of how do you feel in the downtown space, and do we need to activate some spaces more? So I think
some surveys about how people, like the perceptions of what the downtown experience is like.
Yeah, I mean, and we're not planning a physical paper survey or something, but I think in our outreach to and our desire to get information from people will be, kind of talking about where are the spaces they like to be, where, what can we do to activate a space better? Maybe they'll feel more comfortable or.
And the overall viability of the downtown, retail, and so forth.
Gotcha.
Economic development.
All right.
Yeah.
Well, if you want me
I'll lean on you.
to start,
Please.
I can tell you a little bit about what we're doing. So probably around, I think, summertime last year, the chief asked me I do a lot of our community projects, or run a lot of our community projects. The chief asked me to get together with some members of the community, some partners in the community, and start looking at different ways to combat this, what I'll call a public emergency, the opioid epidemic and the problem and that's caused nationwide, not just Brattleboro. So we got together with some obvious partners in the community that could be helpful in this, because we knew we were seeing a lot of people that were saying, Brattleboro Police Department, what are you doing about panhandling? What are you doing about drugs? What are you doing about downtown? People don't feel safe. And there's a lot of different factors that go into that. It's certainly not just a police issue. So we brought other people to the table, Groundworks, the hospital, we have a representative from the hospital, from the community health team, Habit Obco, the methadone clinic, the Suboxone clinic. At the retreat, we had a representative from the high school, because we want to get more preventative stuff out there. Turning Point, of course, has been huge. So we just got everybody around the table and we started talking about what are some of the things we could do. We partner with this organization called PARI, which is the Police Assisted Addiction and Recovery Initiative. It's a national initiative where police departments across the country have had a lot of success in different types of environments with different demographics, combating the problem in different ways. So we learned about how other people were handling the problem, and both small populations and large ones. We kind of put our minds together. At first, we really didn't have a hold on what we were going to do, and then we started seeing what the problem was and what the barriers were that are in place. So some of the barriers that are in place were transportation. People that wanted to get into treatment didn't have a way to get there. there was a lot of stigma involved with the different public service agencies out there. And we realized that housing was an issue as well. A lot of people were going to treatment programs and then they had nowhere to go afterwards. Hence, they're all downtown in the community. So we started looking at the problems and what we can do. And long story short, we put together, trying to make this as to the point as I can, we put together some basic initiatives.
Just remember, you're the only thing on the agenda, so.
Right. Well, I'll do the opposite now. But yeah, basically we started putting a multi-pronged initiative into effect, looking at what the problem was and what we could do to combat it as best we could. So we looked at it from the prevention angle, what are we doing to get the message out to people in the community. There's a lot of talk about overprescribing opioids in the community. We wanted to get into the schools because the starting age for people using opiates is starting to get younger and younger. I don't know the exact stats, but the average age where people start using is very low. So we wanted to get into the high schools and start talking to people and start reaching out with the substance abuse counselors and what we could do to get our word out.
Do you have physicians as well? Do you have doctors?
We don't, but that's one of the things we're looking at, that we should be looking at and getting more involved in, I think.
Yeah.
But we still have a ways to go. There's still
Sure.
a lot to do. That's the prevention piece. And then we started looking at how can we be a little more proactive. So we've partnered with Turning Point, and we've gotten some really good people from the community that are former drug users, that are in recovery themselves. Some of them for not that long, but they know what people are using, they know what they're going through, and people tend to listen to them more than they do me or Josh or anybody else in the community because they've been through it. Obviously, you're going to listen to people like, I suffer from migraines, so I'm not going to listen if you've never had a migraine and you start giving me input on how to handle migraines and be like, yeah, whatever. But if you've been through it, then I'm going to listen, So we've been going out with them, partnering officers with someone from Turning Point, and we've been going out in the community. We've started to kind of collect stats as to where the usage is occurring, where the small, low-level crimes are occurring, where the problems are that we're getting called for at the police department, and we're kind of sending people out to those neighborhoods and talking to people and getting to them, asking them, what can we do for you, what resources can we provide? And sometimes it's get out of my face, sometimes it's, well, my problem isn't like, I don't need to get on a treatment program, I just need to get housing. I refer them to Josh or Rihanna, because we have those partners available. And the biggest part of this, without getting too much off base, is the partnership. Like, before this wasn't happening, this communication between all the different groups has gotten so much better. I've got everybody's cell phone numbers. There's, like, if I have a housing related problem and I see somebody in the street at, 2 in the morning, I might give Rihanna a call I give her a little bit of time at like 7 in the morning and say, hey, what can we do to kind of, like, it's just much quicker than it was before and more efficient. But yeah, that's a big piece. We're going out in the community. We're trying to be proactive and, like, believe it or not, like, get to people before they overdose, so we're not responding to it. And then when people do overdose, we're trying to catch up with them within the next week afterwards and just offer them some resources, like, what can we do for you? What can we provide you? What can we do to help you? What can we do to get you in a treatment program faster and more efficiently? And part of doing that is we've met, like, the police department and some of our partners have gone up to some of the inpatient treatment facilities up north, and we just grabbed a cup of coffee and talked with them and said, hey, just getting to know them so that when we call and say, I have someone in the community I would really like to get into this program, they know us, they're familiar with us. And one of the things we learned from the PARI presentations that we observed when we went to their conference up in Boston was that the police across the country, for whatever reason, have a lot of influence over these treatment providers. Like, when a police officer is calling, or a police lieutenant or chief is calling, they're getting a better response than if someone from Turning Point is calling, or HCRS.
Oh, that's interesting. So you make the calls now? Sometimes someone from Turning Point, but if someone from Turning Point says, hey, I've been having a little trouble with this, could you give them a call? Like, we'll do that for them, and we'd like to do more of that. So if we can use our influence just a little bit to help make that a little bit faster transition, then I think it's a good thing for everybody.
And then, you know, we've opened up the police department. We've said if anybody wants to come in, you know, we'll take care of your drug. Whatever drugs you have on you, we'll get rid of them. We do have a medication drop box. That's another part of the prevention piece. And we'll get you in touch with someone from Turning Point, and we call them recovery coaches because they have the ability to, again, empathize with them and kind of get some direction as where they want to go. So sometimes people, they might come into the police department or Turning Point and say, look, I'm just having a little bit of a hard time. I just need someone to get, I've already got something lined up for next week, but I just need someone to kind of guide me through the next week so I don't use again. So I connect them with someone from Turning Point or Groundwork so that they have somewhere to go and someone to talk to until then. And then...
Is there usually a wait between someone is going into treatment? Like, can they do that immediately? Or
it depends. Sometimes there's no wait, sometimes they can get right in, but then there's always obstacles like health insurance and transportation and things like that. So there are some people that are able to get in right away if it's the right circumstances, and then sometimes there's wait times. But what we found is when we've gone to these programs is that there's always ways to get someone in. Like who are we kidding? If it was like, I don't know, the president's son that needed to get in, they'd get in. Like, there are ways to get in there. So, you know, they might be able to take a bed from here and move it over there. So that's part of what we talked about when we went down there. Like, hey, you know, if we call and we really needed to get someone into treatment ASAP, what can you do? And there are options. But yeah, it takes looking at all of those things. The transportation and insurance is a huge barrier. And that's something that I'm sure Josh could speak to because they help, Groundworks helps a lot with that.
so people don't have insurance, what do they do?
Yeah, that'd be a good question for Josh.
They don't have insurance. Ideally, we're working with people and engaging people before it comes time to have to use insurance. And so it's one of the services that we provide in case management. You know, in addition to being part of Project CARE, we also have Brandy Starr, who does outreach in the community, folks that don't have housing, and trying to keep tabs on people in the community, connecting them to resources as much as possible. So if you don't have insurance and that time comes that we're trying to get you into treatment, I think it's a tough barrier to get over. You know, we're scrambling to get people signed up just as quickly as possible.
And is Medicaid count? Does
As
Medicaid-
insurance?
Yeah.
I think in most cases, yeah.
So,
Do
I
all-
bet you a lot of Brandy's work is getting people onto Medicaid if they're not.
And all kinds of government
similar,
documents. Yeah.
yeah.
Getting birth certificates so you can get driver's licenses so that you can apply for housing and employment and get on insurance. Absolutely.
Yeah, and part of this is it could be something as simple as I need an ID. I hear a lot of, one of the biggest, I'll say, excuses, I guess.
Seemingly simple, yeah.
Yeah, that I hear when I ask people, like, you know, sometimes a lot of the officers just go up to someone panhandling and say, what can we do to get you, you know, in a better state? And a lot of them will say, look, I've got, you know, I came here from Memphis, Tennessee, and the only way I can get an ID is by getting a hold of someone in Memphis or getting a ride to Memphis, you know, and then Josh's people might come in like, well, there's other ways to go about that, and they'll figure that out for them. And we also have relationships with the outpatient providers, the medication-assisted treatment. Sometimes I talk too fast for me, I'm good. But medication-assisted treatment, we have pretty instant access to that in town with Habit Opco. A lot of the time,
What's that?
That's the methadone clinic on Putney Road. Yeah, it's, you know, preventative medication, and they have sometimes, like, they, depending on the day of the week it is, they can get someone in there that day for an to get an intake and get them with a doctor and prescribe and go from there. So it's a pretty quick process, turnaround process. And again, I've got instant access to, Christ, I can't remember his name now. Oh, it'll come to me. We have instant access to management over there as well as the Suboxone clinic, depending on what someone's needs are. And another thing, a couple of the other things we're doing, State's Attorney's Office, they're a partner of us as well. We're trying to lean more towards diversion programs for minor, you know, possession offenses and trespassing.
That's the
and things like
restorative
that.
justice
Yes,
piece of
yeah,
it?
Yeah.
So restorative justice is a state program, but it's run by a
Yeah,
private
a private
agency.
organization. I'm not sure
But
how all
they're
that works,
housed
but
in,
the municipal center.
Quasi-municipal.
Yeah.
They're quasi, yeah.
Yeah.
So we're trying to gear, like in the case of minor possession offenses, like it's been shown across the country that jail slash prosecution isn't working for these low-level offenders. And one of the big pieces of this program is separating the low-level offenders from the violent offenders that come into our town and victimize people. So who is in this town victimizing other people and who is being victimized by that, I think is a big, huge separation that we have to look at. And sometimes that's a gray area because a lot of the low-level offenders are selling drugs to support their habit. So there's a lot of people that are kind of in the middle there, but again, most of those people fall into the victim category when you really look at the big picture. But then you have people like the gentleman that was just arrested from Hartford, Connecticut for coming into our town, clearly victimizing people, wasn't using himself, was finding people, victimizing other people in the community, very violent. Those are the kinds of people that we want to prosecute and we want to go after. And the people that are being victimized, we want to get them the help and supports they need. So
this is the Oak Street story?
Right.
Yeah.
And I can speak more on that, but that's basically what we're trying to do. So we're not piping down the enforcement. The enforcement has actually gone up a little bit since we began this program, just because we know we need to hit those areas. We need to hold people accountable too.
But it's more targeted, would you say?
Right. We're trying to do. Another big piece of this is we're doing a lot of training with the officers. We brought people in from Turning Point to talk to the officers about their use and recovery and their interactions with the police department, what we can do better, what we have done well, what we haven't done well, and learning when we're conducting enforcement, looking at the big picture, like what we're really trying to do. So again, trying to hold those people that are victimizing others accountable, but getting other people the help they need. And sometimes that means still arresting them and providing them other options, though, along with that arrest. So that's a big piece of it. There's a lot of things, the Vermont Opioid Coordination Council, they just came out with a lot of recommendations. It's a council that was formed by the governor to take a look at the opioid crisis and see if they could throw some resources at it. And they came out with a lot of different recommendations, some of which we're already doing. They talk about having recovery coaches in the ERs. I believe that started this week, didn't it? Or it's basically imminent, where basically someone from Turning Point will be available, I think 24, at least 10 a.m. to 10 p.m. And I think that they have call-in hours as well on other times where if someone is the victim of an overdose and they're at the ER, one of these people that I spoke of from Turning Point goes over and meets with them, provides them with resources, asks them what they can do. And then, it's going to work out for others as well. People that have questions, family members that have questions, will have somebody available, where they can go and talk to them and say, hey, what are my options? So that's already they talk about more investment in after-school programs. I think that's something we can work on here in Brattleboro, like give people something to do so that they have other things to do besides drink beer and use drugs. Improve access to transportation, that's ongoing. We got a grant from the United Way. They gave us $2,000 to basically use towards transportation. So if someone meets with us and one of our representatives from Turning Point and we feel that they could really utilize that service, we've had people give them rides up to treatment facilities, or just rides in town from the PD to Habit OPCO, or from HCRS to the retreat or something like that. So we're just trying to use those resources for that. There's talking more funding for federal programs. Certainly, the Vermont Drug Task Force, they were part of what happened over on 33 Oak Street there. So we definitely need more funding for that kind of thing, more enforcement for those high-level offenders, access to jobs. For people in recovery, that's another barrier that I hear for a lot of people. Like if I could just find a job, then I wouldn't have to hang around downtown asking people for money all day. Easier said than done, but again, we need to throw more resources at that. And then more, what you talked about earlier, prevention with, getting the doctors and medical providers on board, I think is something we can really, that's something we can really work on in this town, getting with the people from the Prevention Coalition, because I still hear stories about people being overprescribed, all the time, and that leads to a lot of these problems as well. So we're just trying to look at it from a multi-pronged approach, trying to look at it as getting away from that police department, what are you doing about the problem? When it's obviously a social problem and everybody needs to be, and that includes business owners, I feel, in town. I think everybody needs to start working on a solution. Otherwise, like if you just say police department handle the problem, we're not gonna get there. It's just not gonna happen. And we do have to change some mindsets. We're doing that. I think we've already seen we've transported people from our lockup to medication-assisted treatment in town on occasions. That's something we haven't done before. Yeah, the partnerships are much better. The communication is much better. We've had people from Turning Point meeting with people and giving them rides to places. So good things are happening, and there's been a lot on the enforcement end as well. But again, it's not one little thing is not going to solve it. It's a partnership between everybody, and that includes people in the community, as far as I'm concerned.
Could you explain the hub and spoke method? Because I hear a lot of people say that that's what we use, and that most of the people are in treatment in one way or the other in that program. But if you could explain how that works, that would be helpful.
Yeah, I'm sure that's something that Josh could speak on as well. But yeah, that's what I'm speaking about when I talk about the medication-assisted treatment. It's they have the Suboxone clinic, methadone, and what's the third one? There's like a third. I can't remember offhand, but those are the basic ones that people utilize. And it just the idea of it is it kind of tapers you off. So rather than obviously if someone stopped using, they have these horrible withdrawal symptoms. That's what stops people from getting help a lot of the time. They just don't want to go through that. It's like my understanding, again, because I haven't been through it, is like having the flu times 20. It's horrible. So nobody wants to go through that. This helps people get through that, but keeps them, at a place where they're able to function, as opposed to being high or using drugs. So it is a drug, but it's a tapered level that they're on.
Is that a hub or a spoke?
Yeah, the hub and spoke, I think the idea of it is...
That was more of a model of...
Yeah.
You can get into treatment, that it's there's all these kind of partnerships and these places that you can enter treatment by ways which you can enter treatment. But I thought it was more of a system rather than...
Yeah, I mean, the idea is, for instance, if you decide to go into to have an OPCO at the methadone clinic and meet with somebody and meet with a doctor there, they do an intake, they ask you a bunch of questions, and they may decide there that Suboxone is a better option for you as opposed to a methadone, because they just act in different ways and they function in different ways. One is, more of a blocker than the other one is. They may say, neither one of these is going to work for you. We really need to get you into an inpatient.
Yeah, and so then they can get you there.
So that's
you can
the
enter
basic
at kind of
idea
any place, right? And then
right. But it's a good way where you've got this option right in the community here. We're lucky to have it right here in Brattleboro, where you can get into a program, be supervised by a doctor, obtaining legal medication, and in the meantime still able to function in society, get a job, start getting your housing together. And a lot of people are being really successful. I mean, you'd be surprised at people in town that have been successful and are utilizing that program right now. And that was that's one of the recommendations, better access. I think we have pretty good access here in Brattleboro to
Was
those
there
programs.
anything in the governor's report that you thought, oh, we really need to start doing this?
Yeah, I mean, when I looked at the prevention piece, I saw a lot more things that we could do. As far as like I mentioned with the after-school programs and the, you mentioned getting a doctor on board. I mean, we do have someone from Brattleboro Memorial Hospital on our team, so we have access to doctors and practitioners in that way. So I think we can do better with that, and there's a lot more we can do with that. There's like little pieces all over that I think apply to us. The transportation, that's something we're working on. Getting more people access to jobs. I think housing is something housing is a huge barrier, and that's something that
we're a little biased,
groundwork.
but we advocate for that, and I think it's in the report where they talk about recovery housing. And so thinking about somebody who is going into treatment who doesn't have housing and then comes out of treatment back on the street, it's near impossible to.
Recipe for disaster, I would assume.
We're just not setting people up well. You know, there's not the stability. You know, regulation. These things are. You know, you go to medical assisted treatment, and there's specific times that you have to be there. There's a regularity about it. There's a rhythm. It just doesn't. It's very difficult to maintain if you don't have the stability of housing. Not to mention, you fall back into patterns that you had before you went into treatment. Not because anything is wrong with the person, because that's just human nature. You're back around the same folks that you hang out with, and potentially a couple days go well, but by day 4 or 5 and 6, temptation is just too strong.
Yeah, I mean, I think we need to do what we can to kind of break up that cycle of people just going through the same thing over and over again. That includes arresting people over and over again and going through the same thing.
So Josh, do you have like emergency housing and then more stable housing?
At Groundworks?
Yeah.
And so just briefly, with the services that we have at Groundworks, we have the year-round shelter, Groundwork Shelter. It's formerly Morningside, that operates really more like transitional housing. It is an emergency shelter. It's a 30-bed shelter. We have intensive case management services on site. And once somebody comes in, the goal is really to maintain sobriety for the time that somebody is at the shelter, and then help them to transition into a more permanent housing situation. We operate the seasonal overflow shelter, which is the winter warming shelter, and that's open from November to the end of April. So it's getting close to about the time that we're starting to think about closing that program. It's a long season and a short season. It's really a paradox. And so that is a low barrier shelter. That is for adults. We do have staff there, but really the goal of that program is to get people in out of the cold. So as long as somebody can be in the space, they're not a danger to themselves or anybody else, they can walk around, they're more than welcome to stay. Then we also have the day shelter. People can come in during the day, get a cup of coffee. It's an address, so if somebody doesn't have an address or a place that they're living, they can have mail sent there. In terms of engaging with the system, that is a huge benefit and a huge service that we offer. And then take a shower, get some food, connect with the case manager.
And you separate out families from adults?
In which program? Like in general?
In general.
I think like the overflow shelter is not a place that we put children. And so there's other supports in the community that support families with children. A Groundwork shelter, absolutely. A quarter of everybody that we serve is a child under the age of 18 that comes through that program. I'll also say we have this partnership that we've developed with Wyndham Windsor Housing Trust and HCRS around Great River Terrace. So that's the former Lamplighter. It's been a resounding success. 22 units, micro apartments, services on site, permanent supportive housing. When people move in to Great River Terrace, they sign a mainstream lease. They can stay as long as they want. It's not transitional housing. It's actually permanent housing. So it's gone really well.
I've been there, it's lovely. Have you been there, Sue?
I've not. I missed the opening.
You're welcome anytime.
I'd love to see it. Are there more, I mean, I know funding for housing at the state level is tight and competitive. Is more of that happening throughout the state?
Throughout the state, I'm not sure if there's other permanent supportive housing projects that are in the works throughout the state. You know, right now being built is the Snow Block. Yeah. Right downtown, so there's more affordable housing that's going there. Groundworks is also building a more permanent overflow shelter, which is not necessarily housing, but it gives us a more permanent location for these crucial and critical emergency seasonal shelter beds.
Where's that going to be located?
Where we are on 60 South Main. So we purchased the property next door.
Yeah, I mean, I think that'll be helpful as well, you know, a new facility like that. Again, somewhere for people to go, something for them to do during the day.
And not to overuse the term of hub, but really seeing that as a service hub and locating case management services there, as well as the shelter services under one roof in a much more appropriately sized space. Through this process, we've learned that really the room that is dedicated to the day shelter is about 250 square feet. So if you think about why are there so many people on the street, there's not a place for people to go physically. So when you come into the drop-in center, it's extremely tight.
Yeah, it's like a little rabbit warren of rooms there.
We do the best that we can do with a cape that was built circa 1780, we've learned in this process.
That staircase is a killer.
Does it have low ceilings?
No, it's very steep.
It's an intense pitch. In 1780, they were not scared of a pitch.
Yeah, I think that's and again, that's something that was mentioned by this council, so hopefully when they start throwing money around the state, that's something they'll apply some money to. And I know there's a lot of grants pending going into this type of thing, because from federally down, they recognize that this is a problem. So, and they're looking at ways to combat it. And people are saying this is one of the things we need.
So, does your group, in addition to coordinating, do you have like a list of what you would consider priorities? And if someone were to fund something, you'd say, okay, I need these 5 things.
Yeah, pretty much. I mean, transportation is certainly a huge one. Like, we always list that as a priority. We need to make sure that if we're improving our access to treatment, that we have a way to get them there. Because it really hurts us to say, hey, yeah, Valley Vista would be perfect for you, but we have no way to get you there right now. So that's a big thing. Housing would be up there. Having not full-time, but at least part-time, right now we're using volunteers from the community to come in. So if someone, and we don't have a ton of it, but if someone was to come into the police department and say, look, I'm looking for help right now, I call someone from Turning Point, and it's a volunteer that comes and meets with them and talks to them, whether it's at Turning Point or at the PD. Certainly a priority would be to have a paid position available from the community where people could do that. And again, that's somebody that's in recovery that you're giving a job to as well. So, and when people see that, if someone's homeless and they're using, and they see, oh, look at this person that's coming to meet with me, they're getting paid to do this, and they were in my position at one point, I think that pays big dividends. They see there's something to strive for.
In terms of this prioritization, at the risk of just throwing out acronyms, and I don't know what they stand for, but there's a COSU right now. There's a HRSA grant that was awarded to Brattleboro and larger Windham County, and it's a planning grant that's going on around this very question of, if you did have money, what would you prioritize as a community? And so that's happening, and it's being administered through HCRS, and my really good friend Chad is the organizer. And
yeah, he was at the select board.
He was at the select board talking
ago,
about this, and he's going to kill me that I don't know what COSU stands for, and I'm frantically trying to text him right now just so I can represent for him. But I think that is happening, and they're trying to engage groups, not only in Brattleboro, which is really the service center for southeastern Vermont, but actually out into other communities in Windham County as well.
Yeah, and it's certainly the prevention piece as well. I think that's a place where money certainly needs to go. Again, like after school programs, day programs, like what's going on with Groundworks, and more education of the community to practitioners, to the medical, and dentists, same thing.
What about to employers?
Yeah,
Education for employers.
I think certainly that would apply as well. Obviously, I think there's definitely employers that are hesitant to hire people that are actively using or have used in the past, or that don't have housing. If they list 60 South Main Street as their address, I think you're going to see some hesitation from some employers. So, yeah, I think education will be important for them as well.
It's this piece, I'm thinking about the context of the work that we're doing, but also the question, why are we here? We're talking about the plan that's coming up. And, the thing that I like about Project CARE that you put your finger on is this community effort. It's people coming together. It's around connection. And there's a great TED Talk, Johan Hari, who says everything you know about substance abuse is wrong. And so he goes into this long, I'm not going to go through the whole piece, but to give you the punchline, his thing is the opposite of addiction is not recovery. The opposite of addiction is connection. And so you said, how do we make Brattleboro a place for everybody? And so seeing people as not a liability or a problem, but actually folks that are not actively engaged and connected to the community. And what are ways that is coming out? Through Project CARE, you have folks that are recently in recovery that are then going out and making connection back into the community. I think that that's a wonderful example of that. We tried to get a jobs program going on, an extremely low barrier jobs program, and we've struggled with the administrative side of that, and Youth Services has now taken that up and is working on some of these pieces. But a way for people to contribute, a way for people to engage in ways that they're not able to right now. And so I think, you know, what are we educating people around? That's a question for me, because it's the underlying beliefs that we have about substance use or housing insecurity that really inform the programs that we are putting out. And so if we believe that poverty or homelessness is an individual moral failing, that will lead to particular programs that come out of that thinking. If we think that poverty is a systemic problem, we think that homelessness is something that comes from lack of transportation and jobs and really availability of housing, that leads to very different program interventions or potentially planning in the town. And I think it's hard with substance use in particular. There's a lot of stigma around substance use, and we're seeing now in the conversation around substance use and the number of people that are dying, this opioid epidemic is being compared to the AIDS epidemic back in the 80s. And if you think about when the AIDS epidemic came out, it was very provocative in the sense that it was gay men that were dying from having unprotected sex. And the pushback that that caused, and really the conversation turned to how do we save people's lives? And they did an amazing job of education, you know, across the country to do that. And I think we're in a similar position with substance use, where really our goal is saving people's lives. And the framework that we're coming from is a law enforcement approach, and there are places for that in this conversation, but it's not the end-all be-all of how we're going to get past this. And so what are some other ways and approaches that we can use to help? And so one of the things that we use is a harm reduction approach. And so it's really, how do we keep people safe? And examples of harm reduction are sharps containers in the bathroom, are having Narcan widely available on site, of having needle exchanges in our community, of having fentanyl testing strips. Fentanyl is a synthetic opioid that is extremely deadly. And all the way up to safe injection sites. We don't have safe injection sites, but that would be a harm reduction approach. And so thinking about those items starts to...
But the federal government won't let you have them.
The safe injection sites? No, but I don't say that to advocate for them right now, but just as an example of harm reduction, and to say that that is a continuum of things that you can implement.
We do have a needle exchange in Brattleboro that's been pretty effective. I mean, it's amazing the amount of, it's another good place to visit. And we brought some of the officers there as well to get a better under, because there's some negative stigma behind that as well. But you know, the way I pitch it to them is, if you look at the amount of needles that they take in, I'd rather have them there than in the park, at Memorial Park, you know, so, or downtown. So it makes sense to me. The Good Samaritan Act is an example of what Josh is talking about, educating people on that. That if you call the police, if you call 911 and say it's somebody's overdosing, like we're not, and we find the heroin packets, like, we're not going to arrest them or anybody there. You know, they're protected by that act. So I think a lot of people are aware of that, but some people aren't. You know, there's still occasional we're getting calls too late because people are afraid to call the police or EMS because they're fearful of maybe not the person that's overdosing, but other people around them who are going to get arrested. But Narcan's definitely readily available. I mean, there's a lot of initiatives around that. I think Brattleboro is ahead of the curve when it comes to things like administering Narcan. You know, you can get, it's really available in so many different places in town, and a lot of the people that I deal with that are actively using have it, you know, with them. So, and the fentanyl test strips is something that's been talked about, and I think there's a good chance that'll happen and that they'll be available. It's just a matter of the logistics behind it, but there's been conversation behind that as well. Again, trying to keep people alive until they can get themselves into treatment.
And have you had more public forums to discuss this plan with people, other than, I guess, the select board meeting?
The COSU plan?
Well, just what you're talking about, Project CARE and so forth?
Yeah, I mean, Project CARE, I've spoken at a number of events. I mean, the chief has spoken with the select board about it, certainly. They're up to date on it. You know, we had a symposium at the hospital. That was mostly healthcare workers, a lot of firefighters, EMS, hospital employees, because they're on the front lines of this, you know. And again, there's a lot of, you got to look at it from a perspective of everyone, you know, like the people that are treating these people, the people that are responding to these overdoses, you know, there's a lot of negative connotation behind it because they're dealing with people at their worst. So you want people to understand the whole picture. So we've definitely gone there. I mean, I've spoken in New Hampshire, in Lebanon, New Hampshire, one of the Prevention Coalition meetings. The Brattleboro Museum, they had their piece there. We presented about Project CARE there. It was a pretty good crowd that showed up to that. So yeah, we've done a lot of media stuff. There have been a lot of stories. You know, Vermont Public Radio did a story. Keene Sentinel's done a story. The Reformer, WCAX. There's been a lot of good media that's gone out as well about the program. But there's obviously more we can do. You know.
Do we have any questions? Maybe we should talk more about what design elements might work into this, or do we just need an understanding for public consumption when we're writing the plan?
I think, yeah, I mean, I don't know if you have any suggestions about, you know, having public spaces where people feel welcome, you know, all users of the downtown. I mean, I think it might be a little bit too early, but, you know, you talk to, you know, people in the community, you know, what do they say about downtown, or what, you know, what do some of the people that maybe come and use 62 South Main as the drop-in, right? You know, are there, you know, what do you hear that people say about downtown, or that maybe would make it better? Or
I think the thing that immediately comes to mind is bathrooms. I think there's a bathroom at the transportation center that's open when the transportation center is open.
Yeah.
And so that's something that just immediately comes to mind. I also think, you know, if it's possible to do outreach around, you know, when the time comes to collect information from people directly, and, you know, whether that's at a drop-in center, a transportation center, or elsewhere in town, I think that you could glean really good information from folks, and potentially compensate people for their time, which would, you know, provide an incentive as well for, and just an acknowledgement of the value that people have in their perspective of the town. There's another effort that is just getting off the ground that we are very supportive of. It's the community organizing effort. And this is, Emily Megas Russell has really spearheaded this effort to, you know, it's largely focused around the conversation of people on the street asking for money, and flipping the script to say, okay, definitely business owners and downtown residents have a perspective about this issue and potentially some ideas to work on it, but the folks that are on the streets, you know, asking for money have a perspective as well. And can we capture that perspective and get recommendations from them? It's very early in that process, and we're working out some of the kinks in terms of facilitation and consistency, but I have a lot of hope that that can become a resource for something like this. So potentially, you know, when the time comes to collect the information, here's a group of folks that have been meeting for a while and really been chewing on some of these larger town issues.
What is it called, the
Community organizing effort, the COE. I think there have been 3 meetings so far. So again, just, you know, just early on in that process. But I think the model itself shows a lot of promise and can potentially give some structure to something that can be challenging. Is, you know, how do you organize folks to give input? You know, it can be a challenge. And here's something that is a container.
You know, I can't remember what organization it was, but there is a survey in I can't remember who it was. They're coming down and they are going to be doing a survey in the Brattleboro area, and offering small amounts of compensation for people to come in and almost like focus groups to ask questions about why is it that you're out here asking for money? What could be done to help you? What are, like, just the questions are what made you use in the first place? What allows you to continue using? Just the questions that people want to ask and asking the people, because I think that's probably where to go to ask the people directly. And we've been trying to focus that when we do our outreach with the officers and people from Turning Point. Like, I try to encourage the officers to go out with them to, if you see someone holding up a sign, ask them, what can we do to help you? Is this something you enjoy doing? Is this something you don't want to do anymore that you do want to do? Like, some people, they enjoy doing that and they have no interest in doing otherwise. Some people are doing it because of a need. Like, just ask them. Start asking them questions rather than going by and either giving them money or voicing your displeasure with them. Like, I think that's something regular people in the community could certainly do. I say regular people, like I'm not a regular person in the community.
But is there, then, what would you advocate the public, the regular people in the community do when someone with a sign, when they're confronted with someone with a sign?
I'm a strong advocate of pointing them towards services, pointing them towards Josh and Rihanna and the drop-in center and saying, so if they're saying I need food, like, well, are you aware of what we have in town for food resources? And rather than giving people money and saying, here's $5, like, go in and grab them something to eat. I'm more of an advocate of pushing people towards resources or directly having an impact rather than just throwing a dollar bill or $5, because you don't know where that money's going to go towards. You don't know what that money, you haven't even asked them what that money's going to go towards. And it's not really solving any problems as far as I'm concerned. So I would rather people just utilize the resources in town that are available. And certainly from my end, I've certainly helped people directly. I said, well, what is it you're looking for? And go get them that. And I think the public can certainly be more educated about what the problem actually is and the steps that we're taking to solve it. And one of the biggest questions I get when I do these presentations is, well, what can I do to help? Like, what can I do rather than just give money to someone or something? And there's a lot of things that I think people in the community can do. There's volunteer, I know Groundworks, I'm sure,
we'd love volunteers.
Could use volunteers over there. And how, like, I would feel so much better to be working at Groundworks and supplying people food that are coming in and taking the initiative to go in there and get food. Like, I would feel really good about that rather than just giving somebody $1 near the co-op, Turning Point, now that we have people coming, going out in the community, interacting with people, they have some vacancies at their desks sometimes. Like, they could use people to just go in and sit there and to field questions or to interact with people when they come in. There's lots of little things. Like, business owners, you could provide gift cards to say volunteers, we can't pay you, but here's a gas card, or here's a card to a business in town to thank you for your efforts. Those kind of things. I think go a long way. So there's a lot of things that people can do, I think, in the community without just offering money.
Do you have anything you want to add?
I think, giving money is a personal decision. I don't advocate one way or the other on that. I do advocate for people to feel comfortable to make eye contact and acknowledge another human being. I think it can be uncomfortable for folks who do have resources when they walk down the street and they're asked for money. And some people respond by not looking or being cold or that kind of thing. And even if you're not going to give money, you can say, no, I don't have any money today, but I wish you well, or whatever, and just make that connection. Again, going back to what we're talking about, as much connection as possible.
And I think, like, along with the education piece, like, from a law enforcement perspective, like, I'd like the public to know the difference between someone that's being aggressive or violent or someone that's just asking for money or holding up a sign and asking for money, which is perfectly legal and fine, as opposed to, like, knocking on someone's window repeatedly, not letting them out of their car, getting in their way when they're trying to pass, just following after somebody, being really aggressive with their language, things like that. That's a big difference than an interaction with, hey, could you spare $1? No, I don't have it right now. That's a completely legal, normal interaction, as opposed to following somebody, harassing somebody, threatening somebody. That's different. Like, that's where the police should step in. But otherwise, it's a social issue as far as I'm concerned, something that's, again, everybody, I think, needs to work towards.
And I know everybody has a different perception of what's aggressive or not.
Right.
Have you guys found aggressive panhandling? And
We have.
I mean,
we have. I think
it's
it's
not been my experience. But.
Yeah, I think it's less common than people say it is. Like, you know, again, media is, you know, social media is huge these days. So I think people get scared. They see things on social media and like, oh my God, aggressive panhandling. Like, yes, there are some people that are very desperate, and I think like there are some people out there that are very desperate and very aggressive. But I think that's not common. Like, we have made arrests in those cases, and we're pretty hard on it because, again, not just because we want people to feel safe in the community, but I don't want people who are going about it in a legal means, like people who are just going out there and holding a sign up, are being very reasonable and peaceful, to be affected by the few people that are going out there and being very aggressive. So yeah, I mean, we have made arrests, but it's certainly not as common as the perception is.
In terms of
I mean,
crime
I
statistics,
didn't think it was common.
in terms of crime statistics, is Brattleboro a safe town?
Yes, I would certainly say so. And you're talking to somebody who grew up in Springfield, Massachusetts, where I've walked around in this town with my wife and dogs and kids, Halloween, there was that, what was the event on Halloween?
Oh,
the shopping. I mean, I was downtown in the nighttime hours. A couple people asked me for money. It was very polite and respectful and courteous. It didn't affect my enjoyment of the night whatsoever. No one was aggressive. I didn't see anybody acting aggressively out there. I've gone out, I've seen people out and about. I work overnight, so I see people walking in and about downtown at 1, 2 in the morning. I consider this a pretty safe place to live overall in the big scheme of things. I mean, it's a town of 12,000 people, so you're going to have some incidents. It's not New Fane or Guilford, but when you put it in perspective compared to other places, this is a very safe place to shop and be during the daytime and at night.
So if we were to do some outreach, say we were able to come to the drop-in center, or maybe, do some outreach at, I guess it's not outreach, we'd actually be looking for community input. Turning point or whatnot. We're not going to be in a position to pay people. We can bring food. But any other suggestions?
I don't know, your format. I'm thinking we did some focus groups with the hospital, BMH, a few years ago, and so we had 2 or 3 different focus groups where we had clients come and talk about their experience with both the hospital and the healthcare system in general. A lot of great information came out of that, and one of the projects that came out of that is there's a nurse now from the Brattleboro Memorial Hospital that's embedded at Groundworks 25 hours a week. And so it's not a parallel medical system, but really somebody who's focused on the needs of people at the drop-in center that can help direct them, more like medical case management and triage. And that came out of those focus groups. And we would be more than happy to help support that process.
That's one of the things that's on our radar too. Like, we've talked with some of the separate partners in our group about, over the course of our next couple meetings, we've been meeting once a month, is setting up some kind of a focus group of people in the community. And heck, you don't have to offer much, like some food, I think would be enough to get people in and willing to talk about things. And again, I think you can get donations from people. I mean, we've done our community barbecue and other community events in town, and we've gotten a ton of donations from CNS, Hannaford's, some of the local businesses as well. So I think it's definitely something that can be accomplished and useful.
I know where to get soup.
Yeah, exactly. And I bet you, just in talking to people that in the community, you'd probably get all kinds of, I got soup and I got salad, and before you know it, you've got a buffet out there, and you've spent, you haven't spent any actual funds.
One
to
of
do
the
it.
placemaking ideas that I like is kind of shutting down a street and having a community table and inviting people in. I mean, it's more, about creating community and probably creating the connections than it is necessarily about getting input, but just kind of creating that.
The good thing about our, like when we had our community barbecue, that was kind of our kickoff, and we've done that before, but we held it downtown on Flat Street there, and it was kind of our kickoff for Project Care and talking about it, and it was great because I think it's successful because not only, like, you get everybody, you get the business owners and the shoppers and the pedestrians downtown, you get the people, the group that we're talking about, the people that are panhandling or homeless in town are attending this barbecue, and I've seen people that I've arrested many times come by and grab a burger from the chief and captain. So I think that's a good thing that we're getting everybody together in the same environment, and everybody's happy as could be, and they're all having conversations about what can be done to make things better. And I think that's a good start.
Sounds great. Well, thank you both very much.
Thanks for having us.
Yeah, thanks for having us.
Yeah, appreciate
Thanks for
the work
giving
you
up
do
your time.
and coming.
Yeah, and if there's anything we can do in the future with any of our partners, then feel free to reach out.
Great.
Who was the TED Talk by? Johan, what was his last name?
Hari, H-A-R-I. It's really fantastic. I would highly recommend. Really provocative ideas.
Who are you working with at the high school?
Hanako Jones is her name.
I would encourage connection with Chad Simmons again, the KOSU.
Yeah.
I'm sorry, Chad, that I don't remember what. But they're doing just a lot of great work right now in collecting information and putting together a plan. And then that plan they'll put forward for hopefully an implementation grant. So this work going on in the community. This issue is really, I think it's fascinating because it's everybody's problem and it affects everybody, and at the same time it's nobody's problem. And so this KOSU, Project Care, is really starting to coalesce people around the issue in new ways. You talked about new and better communication and interacting with one another. We're starting to see that in a couple different venues, and that gives me some hope.
Yeah. I mean, I've had I've had text conversations with Justin Johnston. There was just an article about him and the Commons or VPR talking about how he went from using and selling drugs to helping us to accomplish our goals. And it's just interesting. Like now I'm texting back and forth with him. There was a time in my career where that was quite the opposite. We were looking for, looking for him for other reasons. So to see people that have succeeded and been effective, like, it just shows that it can be done. But it's not going to be overnight. It's not like, I think a lot of people are expecting, a lot of people in the community are expecting, like, they don't understand the entirety of the problem, and you're saying, why can't you just do something about this? Why can't you just kick all the drug dealers out of town? And why can't you just arrest everybody? Why can't you, like, I don't understand, why are all these panhandlers downtown? Why can't you tell them all to just go away? Why are there homeless people standing in front of my business? Like, it's not.
Yeah, well, there's
simple.
a lot of questions like that, and that's why it's just so good to keep,
Yeah.
keep the conversation going, and this whole idea about connection is important for everybody.
I think it starts with educating people, like, being homeless is not a crime. Like, you can't say because I don't like the looks of somebody in front of my, sitting on a bench in front of my business, you need to kick them out. Like, so that's why I say getting away from the police mentality about everything, and calling the police for everything, and getting more towards using other, resources in the community. We're getting there.
Interesting. That sort of makes me think about when we talk about asking people about their perceptions of safety. Maybe there's a different lens or a different language we can use to approach that.
Right.
Different with maybe less of an us and them sort of perception.
Yeah, and again, it's like there is different perception and different perspective, because I have to sit back and understand sometimes that people that grew up in Brattleboro have lived a different life than I have. Like, to me, unsafe is different than a lot of people in town. Yeah. It's just, and I think a lot of people in town that have traveled to other places have a different perspective. But a lot of these people have grown up here, have lived here, have gone through some transitions, and have not really seen or been through some of the things that others have. So I have to keep that in mind sometimes when I talk to people. Like, it may seem like they're being a little over the top to me, but to them, this is a big deal.
I mean, I'm even just thinking about our public spaces and how not too long ago, you know, benches were removed from here or there because
people were sitting
people
on
that
them.
were
People were
using,
sitting
people
on
were
them.
sitting on
Oh
them.
my God.
And so, you know, I think about it, well, we want to come in and do some placemaking and make these places that people want to go, and that, you know, obviously.
That means everyone
that means
should want to
everyone.
go there.
Everyone should
and
want to
should
go
be
there, and
welcome
everyone
there.
will want to go there. And
And there are things we can
Yeah.
do too. Like, people still need to be held accountable. Like, I'm huge on that. Like, I don't want to seem soft on anything either. Like, you got to have a happy medium. Like, when there's people drinking inside, like when you go inside when we talk about bathrooms, you want clean, usable bathrooms to use. So if you put those out in the community, you can't have people sitting there drinking a 40 on the bench in front of the bathroom, or urinating. Or
In the bathroom?
In the bathroom, near the bathroom. No, there
you
can't
don't
have
need
it.
to say it. We know.
In the elevator.
Yeah.
Uh-huh.
Yeah, I mean, like, you have to be respectful too. So those people need to be held accountable, those people that are affecting. And again, that's a very small percentage. It's like, it seems larger than it is because the incidents get so magnified. But
Yeah.
like, I think we still need, that's our job, is to go in there and deal with those issues so that everybody can be comfortable.
Well, great. It's so much better being informed than uninformed.
Yeah.
And
Yeah.
hopefully, you know, spread the word and use it in our work.
What's your
absolutely.
timeline for the plan?
I need to get the RFP out, so, I mean, it will be done probably by next May, so it'll be going.
year.
Yeah.
And really the public input piece will be somewhere towards the beginning of that process?
Probably through the summer and the fall, probably.
Nice.
Yeah. Yeah. So we'll be hiring a consultant to help us with that. There's kind of a pop-up kind of placemaking event that we're asking them to do. So, so whether it's another, you know, whether it's a parklet or it could be an art installation or something, who knows what it'll be, but
Okay.
we're hoping for something like that as part of it.
Keep us posted.
Yeah.
Thank you.
Thank you.
Yeah.
You too. Well done. Big day tomorrow, Liz.
Do you want to close our non-meeting?
All right. Jess, you want to make a motion?
Oh, yes,
Not really.
I'd like to make a motion to adjourn.
Second that. All right, thank you.